Good evening. The City of Burlington Board of Health meeting for Thursday, 14th of February will come to order. The first item on the agenda this evening is our approval of our agenda and our November meeting minutes. So first of all, we'll review the agenda. Anyone wish to make any changes, additions, edits, what have you?
I have one suggestion.
Sure.
That in your packet you have three communications that we'd received marked 3A, 3B, and 3C. Since they relate to item number 3, I'm thinking either in approvals or in public forum if we could address that and have one of the members of the board make a recommendation that we accept the communications and place them on file as part of the record for tonight's meeting.
And are we talking about the little article?
So there's 3A is a email from Wayne Senville.
Okay.
3B is the Spray Park Public Health Risk Summary dated 2/14/19, and then 3C is the Advancement of Science handout.
You mean the Advancement of Science handout?
That one.
You mean the article?
Yep.
Okay.
Well, it's, at the top it's titled Advancement of the Science. Sorry, that's what I was thinking. So it's on ours we've put them for the record as 3A, 3B, and 3C, and just so that they're officially recognized at either of those two items procedurally, I would ask that one of the board members make that that recommendation and have a vote to make them part of the record, because we don't have a consent agenda. Otherwise, we would have put them in advance there.
Yeah, yeah. So would one of the board members like to make that?
Should we do that as part of approving the agenda?
I think we should accept the agenda first,
Yeah.
and then
Under a public forum, maybe
Sorry,
say.
okay, absolutely.
All right, I move to accept the agenda as it is.
Seconded.
All right, all those in favor of approving the agenda for this evening, say aye.
Aye.
So moved and passed. Now on to the approval of the November meeting minutes.
It's January meeting.
More
Yeah,
like a
it's
January meeting. Sorry, I didn't catch that. We may wish to amend the agenda in the past here.
That looked okay to me.
Yes, likewise. Anybody, thoughts, additions, comments?
Move to accept the minutes of the January meeting.
Second.
Seconded. Okay, all those in favor say aye for approving the November meeting minutes.
Aye.
Aye. The motion is passed. Great. So we'll move on to number 2 on our evening's agenda, the public forum. And why don't we actually, as is often what we do in public forum when we have the honor of having guests around, we can go around and introduce ourselves, and both board members and members of the public. And I will start. My name is David Casey. I'm the chore of the Horde of Belth. I'm the chair of the Board of Health, and I am an RN, and I work for the Vermont Department of Health.
I'm Caroline Tassi. I'm a nurse practitioner in private practice in psychiatry in Burlington. I also work for the transplant program at the University of Vermont.
I'm Taylor Newton. I'm on the Board of Health. I'm a land use planner with Northwest Regional Planning Commission.
I'm Bill Ward. I'm the Director of Code Enforcement, and I'm also Burlington's Town Health Officer.
I'm Steve Cormier. I am a Code Enforcement Administrator who's responsible for staffing the Board of Health.
I'm Millie Eidson. I'm a new resident of Burlington, retired from the New York State Department of Health, and an emeritus professor from the UAlbany School of Public Health in epidemiology, also public health veterinarian.
Kathleen Ryan, a longtime resident of Burlington. I am a landscape architect, but 90% retired. Live on Maple Street in Burlington.
And I'm Cindy White. I'm the director of the Burlington Parks Recreation Waterfront.
Thank you all. So on to emerging issues. Are there any emerging issues that we would like to discuss? And I suppose in that category falls the addition of items 2A or B and C into the meeting minutes.
Yeah, so I'm looking for a motion to accept the communications and place them on file as part of the record of tonight's meeting.
So moved.
A second.
Someone needs to first it.
He said
so-
Oh, you did. I'm
Yeah.
sorry. All those in favor, say aye. Aye. The motion is passed. Excellent. Is there anything else that anyone has that comes to mind before we move on?
I would say, since it's public forum, that it's typical that folks either talk now or when the specific item on the agenda comes up. So I think that's your prerogative as the chair to invite folks up at either now if they'd prefer to speak or wait. I mean, it's only one more. But just
The
procedurally.
agenda, so I don't really know, is the City Hall Park and the
So,
fountain on the
Is,
agenda?
yes,
Okay,
after
great, just
public
making sure,
forum.
thank you.
Yeah, it would be my interest to
Okay, great, thank you.
have a dedicated conversation that would include our guests on the City Hall Park fountain. And if there are no emerging issues to discuss at the moment, other than that, we'll move on to item number 3, the proposed City Hall Park fountain. So I think what I'll do is I'll start with Dr. Idison, and you and Wayne Sainville have expressed some concerns about the fountain as it is right now. And actually, I'm going to step back. Why don't we have Cindy White talk about, kind of provide some overall information on the construction and the schematics and approach that you all taking for the fountain.
Yeah, so I brought some just drawings, just to, if anybody wants to look to see what the what the sort of undergrounds look like. Basically, there's tanks underground for the whole system. Let's see if I can find the right. They tried to set me up, the staff, for where all that is in here. You start just seeing that there's a whole system of pipes and tanks they're in vaults, all the plumbing and filtration system for the fountain. It is a recirculating fountain, so that means that it's treated with the ultraviolet and the chlorine, as it passes through the system. It's basically very similar to a pool. I worked in Rutland for 16 years where we had a pool. And in many ways, there's some aspects that are very similar, like your water goes through, it's all treated, and then it comes back around again. The one big difference between a pool and a splash fountain is that there's no standing water, so you don't get the lifeguard issues as far as needing to have a lifeguard there all the time. And then I also just brought some specs as far as from our, if anybody's interested in them, that tells more about the guidelines. And one of the things that's interesting and unique about Vermont that we came up with when we were also just renovating, I still use we because I was in Rutland for 16 years. Rutland just designed a new pool. There's this beautiful new pool in Rutland. And Vermont's kind of unique. There's no codes in Vermont related to pools. And so in Rutland, what they chose to use was the model aquatic codes is what was used there. Delta, who designed this fountain and does fountains all over the United States, they said there's basically two, the most strict standards are Florida and New York. And so they've used Florida's standards for all the designs and specifications for the fountain here. So while Vermont doesn't have those codes, they've used another state's codes for that. And as we did in Rutland, there would be certified pool operators that would be trained for that. And one of the things about this system that's kind of nice is, and part of it's just modern, and I know Rutland has the same system now that they've got a new updated pool and updated pumps. is that not only are you individuals checking this, but it shuts down. So like if your numbers aren't in a line, then the system just shuts down. So for some reason, somebody, it falls, short in what they were supposed to be doing, it would shut down. And I know often people reference Seneca, New York had this really like horrific case that happened, like I think it was 2004. It comes down to just poor maintenance. Florida in 1999 had another horrible outbreak, and turns out nobody filled the chlorine tank and they had no filter. It was a cesspool. So of course bad things happened. This is a professional fountain that's being designed by a company that does these hundreds of these types of interactive fountains throughout the United States. So it's not I guess it's a very professional commercial installation that's well designed and again built on Florida standards. And we realize it's basically just like running a pool. You got to make sure your pH and your chlorine are all online, and UV is also in there because it's splash fountains or water fountains, however you wanted to say this is. You have to turn your water over faster because it's not a big pool for everything to, because we all know that children have accidents, so things are turned over faster. Things over faster. So I don't know if anybody has any questions on that as far as
I didn't really know about the fountain much in advance. So is this the kind of a fountain where because I've recently been in several cities in Pennsylvania that have these little splash park areas where their sprays come up and go down and kids run through them, or is this like a fountain?
It's both in many ways. I don't know if you've been to, there's some really amazing ones that are like, there's at Las Vegas, and they have the, everything's done by music, and they're, so they're in plazas. So I've been to places where it's a spray ground. I think it was a spray ground where it's like a playground, and there's hoops, and there's things that crash over from the top, and things like that. And so in some ways they're very similar. Ours is more of a plaza fountain, and so it's, it just goes up. There's no circles and hoops. There's no buckets that tip over. So it's not a spray ground to be like a playground, but yes, kids can go through them. We were in. Where were we? Pittsburgh, I think, as we were visiting the kids, bringing our daughter this summer, and PG Park Plaza has one that, the same sort of thing, vertical fountains that pop up that go, and they also had another one over on the other side of the river that was kind of magical just because they, played it to music and colors, and but all same type ones. And some, though, are not recirculating. They are ones where it's just a one-time use. And the advantages of one-time use is if you're looking to do sort of a more lower budget end, because then you don't have to have all the filtration systems, because it comes up and it goes down and it goes right into your sewer. But we just didn't feel like, that's there's the economics of not having to have your whole pump system. It's really not very environmentally sound. We feel like, as far as it's just a one-time use of water where it doesn't have to be.
Thank you.
Couple things.
Sure.
Feel free to take a seat.
Okay.
Mary, why don't you come up and
Can I
introduce
ask a
yourself?
quick question?
Yeah.
Sorry, I didn't know if you're asking other members to come up yet, but Mary, you're on the board. You should be at the table.
I paid, and I apologize to our guests. I had to open a box of delicate flowers on the first day.
Aww.
I'm glad they would have died.
Oh, they would, yeah.
Cindy, I had a question.
Sure.
Because I know that this is a proposal, so I'm not expecting that you already have, someone like Derek that's put together a protocol for the, when it would be cleaned and when it would be tested and that sort of thing. But are there parameters that you have considered, or?
Delta, so the company that Delta will give us a whole manual. So same thing in Rutland when we got our pool redone there. You came with here's the procedures that you follow, but also so you've got that procedure to follow, but also you've got certified pool operators that they've learned how to do that. But we would definitely have the guidance of Delta, who's this is what they do is fountains. But then again, our certified pool operators will have that knowledge also. And it's helpful, I feel like, in many ways too, that having come working from a community for 16 years that had a pool, I feel a good sense of understanding the importance of operations. Because for I mean, the worst case scenario is anybody got, sick or something like that, but also if you don't take care of your system, it's not going to last. So you've got to keep everything at the right levels.
And a question about the
Sure.
timeline too.
Yeah.
If things worked perfectly,
Yeah.
when would it be, constructed, and actually when's the first day you would expect that it would be in use?
Well, it would be the summer of 2020, because it would be under construction in 19. As far as which exact day in 20, I don't.
No, I mean, but
And we
it's-
might
so
shoot for
it's-
like a
that's
Memorial
fine.
Day type launch
It's
or.
not this calendar year.
No, it will be under construction. Not unless it was a super really warm December when we finished and we said, let's just test it.
Is there, I mean, yes, it's recirculating, but I presume that there's going to be injects periodically and drainage periodically, recirculation of the water or replacement of the water. What is the rate of that? Do you know?
I don't have all the rates as far as it's whatever Florida Health Code tells us to have your turnover rate and everything that it would be done at that rate. I don't think I have that detail with me. If you guys want me to get you a copy of the Florida Health Code, I'm happy to, the code with it, I'm happy to pass that on.
And as you're saying, only Florida and New York have.
Well, no, other states have them, but they said those are
Regulations.
have other regulations.
These are the
It's just
strictest.
unique about Vermont. I don't know why Vermont doesn't have relations. Again, Rutland, they use the Model Health Aquatic Code is what they use for standards. Delta chose to use Florida's.
And so being familiar somewhat with those,
Yeah.
are there echoes of that in this design that you've been able to identify?
I have not gone through all the levels of the pumps, and no, I mean, I haven't. I mean, it's going to be getting more, I don't know the intricacies of the pumping. It'll be more when we get to the point of, having our procedures in place and making sure that's all followed and how they log that they're, everything's being done. And again, you can, now you can just look at your phone and it tells you, what your chlorine levels are, it tells you what your pH levels are. Yeah, it's pretty.
So I don't want to speak for the board, but I'd be curious to know if you would, when that time comes, if you would be willing to review that with the board members when those procedures are.
Sure, yeah,
whether
I'd be
it's
happy to.
advisory or
Yeah.
if they were going to talk about.
Yeah,
or
once we
make some
start getting to that,
recommendations.
once we start getting to that point of, because we're really focused on construction now, but once we get to that point where we're starting to bring the procedures together for the operation of it.
In the chlorine that you're using, so the Model Aquatic Health Code, has chlorine alone, chlorine with stabilizers and so forth. And
Yep.
can you comment on any of that and whether?
No,
it's,
I just know that we're using ultraviolet with it
solid or-
also.
Okay.
That's like kind of that's the next level of just making sure, I think from understanding it's like the UV, there's some, I don't know all the
There's-
technical terms as far as,
Right.
micro, whatever those, it's like that next level of that, what chlorine doesn't get, they nail. So we've got both systems in.
So I'm gonna channel Dr. Idison over there and probably say that cryptosporidium is probably our biggest concern among others, but and the sporulation or the oocytes that are present with cryptosporidium are tough buggers to kill.
Yep.
And I'm looking down the road 6 or 8 years when city budget cuts are horrid and there's another recession or whatever, and what are the long-term maintenance costs on operating
Yeah.
system, not necessarily repairing it or
Yeah.
whatever, but just is this
Yeah.
something that could be on the cutting block, or how expensive is it to maintain on a day-to-day basis?
We would shutter it. It's hard for me to comprehend that someone would think that if there's a recession that we would operate this like poorly run. It's kind of like asking the water department, like, there's a recession, are you going to put less chlorine in your system? It's.
Okay.
I know
I
that
don't want to be
That's good.
disrespectful
That's good.
about that.
Yeah,
It's kind of like.
no, that's appropriate.
I know that the city does test for cryptosporidium because we get those levels in the transplant program on a monthly basis. We don't tell people they can't drink city water. We do tell them if they have private wells, they have to have their wells tested.
That should be annually, correct?
But those are immunocompromised
Right.
patients.
I mean, the state says test your well water annually,
But
correct? how
people
long-
don't necessarily do that, but
Right,
we
yeah.
do. I tell the transplant
Understand.
people they have to do that.
Yeah, yeah. There's a subject matter expert here, and I'm wondering if you have any thoughts or questions or concerns that you'd like to voice?
Appreciate the opportunity. As was indicated, there have been disease outbreaks associated with these spray fountain parks across the country. One very big one was in New York State. And according to the Department of Health, there were about 2,000 cases. According to a major lawsuit that happened after that, they claimed there were 4,000 cases. So that was a large one. There have been others in Canada. Hopefully you got my amended note where I had put it in Niagara, New York, but it was Niagara, Canada, Minnesota, other places. Most of the time, the outbreaks have been from the cryptosporidium or cryptoparasite. Occasionally, there have been ones related to bacteria. The normal disinfection chemicals like you would use in a pool definitely do better at killing bacteria. They don't work against the parasites, which is why most of the outbreaks have been from the cryptoparasite. I was certainly heartened to see in the plans that there is UV as part of this, because UV is what you need to kill the parasite. But the issue is, I wish in the plans that you were following, I think it would be safer from a public health point of view to be following the New York model rather than the Florida model. And you mentioned that you're following pool type guidelines. Well, a pool, I think in most jurisdictions has to be fenced with a gate. And that's, I think, one of the major risks here of this water park, is that it's right in the middle of the city park, right in between the two major diagonal walkways, and there's no fencing to keep dogs, wildlife, children in diapers out. And so the chance of fecal contamination of the water system is high. And if New York's regulations that became much stricter after that Seneca outbreak requires fencing, and I think that should be a minimum to improve safety, to reduce the amount of fecal matter that can get in there. The other big issue is just contact time. I've worked on disease outbreaks that were drinking water, not spray parks, but where everything was appropriate with the disinfection and all that, but because of some issues like high demand or whatever, where the water was being pulled through quickly, there was insufficient contact time of the fecal matter with the disinfectant or the filtration or whatever. And so again, that's an inherent problem. You know, I'm happy that there's going to be chlorine infiltration and UV, but if there's insufficient contact time, it doesn't matter that you have those things. It's not going to have time to kill the organism. And the spray park is inherently hazardous that way, because the fecal matter gets in there and then it could be immediately aerosolized up. These, according to the specifications, these are going to be 6-foot high height sprays. The picture that's in there shows the height lower than that, but the written specifications talk about them being 6 foot high, about being 25 of them, 12 of one kind and 13 of another. And so I'm just concerned that the fecal matter gets in there, then it immediately gets aerosolized into people's faces, and that you could end up with a major outbreak. So I would recommend, if the city goes ahead with the spray park, that you follow the New York regulations and just make it safer, which I realize is going to be more costly. So I'm guessing that may be why the proposal did not follow those, because the fencing and all that would be more costly. I think it would be probably impossible to pull off at City Park. Somebody at the city council meeting said, you know, do it in Oakledge Park, you know, someplace where you have more control, where you can do the fencing, the bathhouses, the foot baths, all those kinds of things that would be needed to make it safer. So.
Let me make a comment just on that New York State incident.
Yeah,
so that was
absolutely.
2004, and they opened up again 2 years later, and I've had no major incidents. I mean, it's that isn't they made the changes that were necessary, and it's, you know, Yeah, it's running great now, but I just assure you that we're not taking any shortcuts, and in this process we will. Yeah, there is definitely no fencing, and again, you go to PG Parks in Pittsburgh, and there's no fence there. I mean, the plaza fountains. There's not fencing but this water will be turned over. The city takes it very seriously that this is an area that children will be in, and.
Can I comment? I'm here instead of Wayne because Wayne is in Alabama. And I wanted to point out that the New York regulation does have calls for a bathhouse and toilet facilities with diaper changing areas. Now, I mean, and then there's no place for that. And I guess I agree with other people who are saying that this is really not the best place for a spray park. That it would be I think it would be terrific, and I think it would be much better used in a park-like area, that's not going to be concrete plaza or play plaza.
Do the city hall restrooms have diaper changing areas?
We will. The restroom that's going to be located on site, the Portland Loo, there's a restroom and it has a diaper changing area on it. We've made that as well.
Well, it's pretty small, right?
Well, it's a one unit. It's a one unit, just as you would walk in here. There's a 1 unit bathroom. It's a 1 unit bathroom, and there'll be a diaper changing area. That's one of the things that you can do as an add-on feature that we decided was not just for the spray fountain, but it's also just more inclusive of families in general going through our spaces.
They also talk about sweeping up the area, keeping the area clean, which would require some staffing. It seems like this place would require regular staffing, at least before and as it's used, and I'm wondering if that's in the budget, along with all the other things of, the filtration changes, of changing the filters on a regular basis, doing the testing on a regular basis, on-site staff, as I said, if there is an accident, who's there to clean it up, and to just to supervise, so you don't have kids who are, maybe you don't allow kids in diapers, but, and just the general repair of the plumbing. Burlington is not known for taking, other than the one at the top of Battery Street, our fountains are not very well taken care of, the classic being the fountain the original fountain that's not there anymore, and the fountain that we see now that isn't functioning, and the fountain in front of City Hall, which isn't working. So we don't have a good record of putting the money and time and effort to keep things going. So I'm really concerned, although you are promising that, the history doesn't show that. And I know you're new, and maybe you can fight for more money, but as you say, when the budget goes down, when there's a recession, that's what gets cut. And so then either we turn it off, that's fine, but why? But it's a feature, it's a design feature of the park. It's supposed to kill two birds with one stone. We wanted a fountain was required, Tony Pomelo is paying for a fountain, and do we end up shutting that fountain down and it's just a piece of paving? And it also was supposed to be a fountain and a play activity for kids. So if that is not maintained, if the money isn't there, which, it probably won't be, what do we do? I'm very concerned.
Did you have a comment?
I was just going to say, I haven't done a comparison between Florida and New York guidelines, and I think if you are going to give advice to the Parks Department on the proposals they'll have, it's probably worth doing that comparison and then looking at greater detail at what they've done in other places regarding fencing or places where they haven't. And I know, listening back to when Cindy was talking about in other places, it wasn't that long ago I was in Savannah where they have something very similar in their square and never gave it one thought. My wife and I took our shoes off and went right in and never gave that much thought. But it also was based on the atmosphere. So I think sort of what we've heard about the public comments makes that true. It is the way that generally the park is maintained is going to tell people, yes, this is safe because things in this area are well taken care of. But if you have trash cans nearby that are overflowing or things like that, that sends a very different message. So I think the way it's designed is really as important as how it's maintained. But again, I feel like right now I don't have the information to give any better guidance than I did, you know, when I first heard at City Council some of the different public hearings. And I've been at a couple of meetings where it's been discussed, but I feel like I still need more information. But I don't want to subject you to how I'm feeling. I'm just sharing my honest observation.
Well, I think what we're balancing here is sort of the concept of a aquatic facility, you know, where there is a considerable amount of human interaction, and sort of the traditional concept of a fountain that you simply look at. And, you know, if it's going to be an aquatic facility, there needs to be the controls in place, you know, to prevent infection and disease outbreak and so forth. Waterfalls in and of themselves don't typically, you know, spread disease. Certainly they can. That's not out of the realm of possibility. But as soon as we start, you know, interacting with the water and getting wet, you know, that's when problems start. And you know, if you go down the path of an aquatic facility, it really changes the character of the park. The fence around it, which is inappropriate. I mean, you would have put a fence around a pool if you're going to have.
If I had a pool with water that was standing water, not a flat surface,
parks, you know,
not a flat surface.
Have, you know, I guess what is it in Canada? It's 3/4 of a centimeter or 3/4 of a meter. You know. Anything is a go, but as soon as the water gets deep, then you know you've got to have the lifeguards and the fences and the signs that say don't change your diapers here, and you know this and the other thing, and it changes the nature, it changes the feel of the park, and the big question is, you know, what do we want for our feel?
Well, I would agree with Bill. I would have to see what is the real difference between the Florida and the New York regulations to know if there's really a significant difference that we would say, oh, well, that's a big difference and we really should do that. I think we would have to know that. The other thing is, there are no outdoor activities that are risk-free. So how risk-free do we want our children to be? Or our citizens, not necessarily our children. We can't be risk-free. So I think if we were going to make a recommendation, I agree with Bill, we would need to know more.
Can we just talk about the context of this too? So the last iteration of the plans that I'm looking at is from August. How long have these fountains been a part of the plans?
Right from the beginning.
From the beginning.
So from
right from
2015.
yeah. And we have a professional fountain, Delta Fountains, has done all the design.
2016. Okay.
Yeah.
All right, and we're in a place where this has final approval from the DRB already?
Yes.
Okay.
DRB.
And so we're in a place where also the money to construct this park is in the budget that's going to ballot in March, correct?
It's not on the ballot in the March, no. This has been approved by the
money's-
DRB.
money's
It's
been-
under permit.
It's already,
We've
okay.
already,
The money's already been allocated
Yeah.
for next fiscal year to construct this?
yeah, this is, yeah, this is,
Okay, just want to understand the context of
yeah.
what we're wading
Can I just
into.
offer something along that line? The bids just came in, and the bids came in about $1.3 million higher than, 0.4 higher than the lower. There are only 2 bids, and the lowest bid was $5.3 million, I believe, and that was over the budget, which was $3.9 million.
Yeah.
I think I'll let Taylor finish. Go ahead.
Yeah, no, I just want to, we're here discussing the public health concerns with this fountain, but I want to understand where we are in terms of where this project is in the process of actually being constructed, and how long this proposal has actually been on the table, and how many people have already discussed this issue potentially. So it sounds like this proposal's been on the table for almost 3 years. It hasn't been brought up as a problem before.
Correct.
I'm looking on the webpage about this. There's been 20 plus meetings about this project throughout the community over the past 3-4 years. if there truly is a public health concern here, I certainly think that we should address it, but I want to understand the context in which we're making this recommendation to the city council. And certainly,
At this point in time.
yeah, and we haven't been asked by city council to look into this issue either. So you know, I don't want to make some sort of recommendation out of the blue where you know what I mean? So I just want to bring it up.
So moving forward, yes, a comparison of Florida and New York health codes I think is worthwhile. And yeah, I would be interested in having a deeper dive in terms of you know, how the fountain is constructed and the tanks and the water purification process and so forth. And so yeah, I guess I would ask that we move to have that, have the materials that you graciously brought
leave them with you.
inserted into the minutes, so we can all review them. And yeah, I'm going to go back to what I said before. It's you know, where do we want this facility? What do we want it to look like? Where do we want it to go? And as soon as you start making major architectural changes to it, it kind of throws everything else in the park off kilter. And yet, I think I'm sensitive to the public health concerns. So yeah.
Can I just make a comment?
Sure.
So I think it's really important that if this is the Board of Health, and so if there's concerns about the fountain, but whether where it's located in the field, the fountain, was the DRB.
Beyond our jurisdiction.
That was the DRB that was made, and they permitted this project. So to me, I think it's a very narrow scope, and right now this has all been designed under the Florida's, because Vermont does not have codes. So they've chosen Florida's to run this by. And I guess I just ask you to stay to that narrow scope.
Yeah, I agree. I mean, I don't mean to suggest that the Board of Health should weigh in on where the trees should go and you know, how it should feel.
Yeah.
But you know, the use of the facility kind of dictates the level of rigor, I guess, that we approach it. So, yeah. All right.
I do have one last question just
Yes.
on the design as related to public health. So I just want to make sure that I'm reading the site plan online correctly. So there is a Portland Loo proposed for, you know, closer to the old bank building that Reroz is in, and that is upgrade from the fountain, but there is curbing there, correct? Because Portland Loo, okay.
Yeah, I don't have it memorized as far as that. I have to kind of look at the drawing again to see what.
I only asked just because of Portland Loo, you can just spray out, correct? Like the facility itself.
Yeah.
So, since the fountain is downhill from the Portland Loo,
Yeah.
I just want to make sure that this is showing curbing, protecting the
Yeah.
Portland Loo from the fountain.
Yeah. Yeah.
So
And
that's
there
what
are
I think I see.
additional restrooms in City
In
Hall.
City Hall as well, yeah.
Yeah.
All right.
So I can get you guys that Florida code, and yeah.
I was gonna say, if you
And
wanna
there's going to
provide
be
it-
some differences. I mean, the reality is
Okay.
each state has
Sure,
their
yeah.
code to.
Absolutely.
And if you want to provide it to us, Steve typically,
Yeah.
you know, communicates with the board, and
Right, I'll
you
send it to
know,
you,
if you
Steve.
send it to one person, he can get it to everybody.
Yeah.
And take it from there.
And it could be that, I don't know this for sure, if like, and they may even have, Delta may already have like, what are comparisons between, just because they put, you know, fountains in other places, so.
New York State, presumably.
Exactly, yeah, yeah.
Yeah. All right.
David also suggests that if she was willing, with maybe the chair's prerogative, maybe Julie would be able to, or be willing to continue her research that she's been doing. It sounds like from the email I got,
Yeah.
she's contacted folks in other communities. I don't want to volunteer her, but if you could have that
Yeah.
conversation with her to see if she would continue to take the lead, and maybe we can have a brief discussion at a future meeting when that was ready and, you know, folks have had a chance to look at both of those codes. But again, since you were looking at next year, I don't see any urgency tonight.
Yep, and then as we get closer to, obviously, and then we can bring our procedures I mean, when we get to that point,
Mhm,
you know,
mhm.
before we open up, is running through those procedures. And if the Board of Health is interested, you know, going on site and seeing how all the operations work.
I just wanted to make a couple points. I agree entirely, we can't go for zero risk as an epidemiologist. I definitely recognize that. All I'm advocating for is reducing the risk by following common sense regulations like New York has. And secondly, although it's not the full council, my two counselors did ask me to come here. I wasn't certain about it and didn't know, you know, and they specifically suggested. So at least there's two counselors who thought that it was important. I mean, I'm sorry that I wasn't living here 3 years ago to give my input earlier. I realize it's very, very late in the process, but, so.
Okay. I think we will be tabling this discussion for the moment and revisiting it in next month and
You're welcome.
times in the future. Thanks for coming.
All right, you're
Appreciate
welcome.
it.
Happy Valentine's Day, everybody. Hope you don't
Yeah.
get too late.
Right.
I don't know if my rose petals are strewn across the field, but I live like directly across, and he told me that my husband could just put rose petals along the way.
You know, if it's not out there, it's probably, we just didn't give them enough time.
That's right.
Thank you all for coming. Have a good evening. Moving forward to item number 4, the
I have to
update.
read all this because I didn't have them beforehand, so
What's that?
I have to read all of these because
Yeah.
I didn't have them beforehand.
All right. Yeah, I mean, some of them only came to you today, I think, so.
But I didn't mail, so.
An update on the marijuana legalization information card.
So I did, obviously I got, where did I put the marijuana? I put them aside so I wouldn't get shuffling through a zillion pieces of paper. But the updates that Nick and I discussed are not on this draft, so that's a problem. And he really, and we talked about making some little, well, I'll try to describe it. So, you know how sometimes you'll get a little handout or something, and then it'll have the text, and then maybe up in the corner there'll be like this little red star, and in the middle of that there'll be, remember this? And he suggested we throw in a couple of those on 2 of these points. So that's what I was trying to say on the 2 side notes. I don't know how to describe that to the graphic design person.
Call out box.
Is that what that's called?
That's one of the terms, call out
Okay.
box.
Excellent.
Well, write that
Those you
down.
keep tonight.
But he suggested that's how we could throw in a couple of these other things that don't really have a space, a topic, but that were still important. Because some things came up as we were talking, he having come from Colorado, that are a little different here with us in Vermont, having an international border and also having a lot of tourists, although they have those also, but they're not surrounded by states where marijuana is legal, so,
Yeah.
and we are. So.
In a lot larger cities closer to us than
Yeah, so
Denver.
that's why he suggested that. And he definitely got it. And his take was, he wasn't saying this is what you had to say or we had to say. That we could have modified it, but he was happy to look at it again. But that we can put some of these shorter sentences for the 5th grade reader, so to speak, and we should do that. And those were the three areas that we discussed. So I'm thinking that this is going to be like a folded card like this is what it looks like to me. Is that? Because this was upside down, so I'm thinking.
I think.
Is it an in and out, or
I
is
think
it
it's a yeah, more like that. It's in a split panel where it
Okay.
would fold up. Right.
That was,
It would fold
which
up.
if memory serves, was more similar to what the Colorado
Yeah.
card, which would be like a wallet size
Yeah.
card that kind of unfolds.
I mean, I like the design. That people like the design.
Yeah.
And I think that if adding these few things is going to make it a little condensed, we could use some different color type for the extra things like, okay, if you can't smoke cigarettes here, you can't use marijuana. You know, that could be in maybe a little different typeface or a little color that would make it not look like so wordy. If I'm sure the graphic person could do that. Otherwise, I was fine with it. But did people have any questions about the changes that he and I discussed? We really went around and around about the cultivation. This is in the long run, because he agreed that this is totally at odds with what it says about you. If your landlord says you can't grow it, you can't grow it. But that's not what the legal stuff actually says, because the person in lawful possession of the property is the renter if he has a lease. So the two things contradict each other because they're in two different bills. And we went around and around with how we could reword that, and we just could not come to any. So he said we should put both in. Does that make sense?
Yeah, no.
Sooner or later, somebody is going to bring that up, and it'll be adjudicated somewhere. I guess.
We'll get case law eventually.
But we can't wait for that.
Were there other areas where you felt like you were at loggerheads, or?
No, actually, he was really. Once I explained to him my thinking about how this is the wording, but we have to address the population, and there'll be people who are reading at this legalized, and there are people who are going to be reading at this level, and we want it to be friendly that everybody's going to use, and he was totally in agreement with that.
So the language you kind of checked off on.
Yeah.
Cool. Excellent. I mean, that's.
So where you want to put, how you want to put these things in, I think would really be, if everybody agrees on the changes or the additions, then it's just, I think, going to be up to the graphic design person and maybe Julie overseeing her on how to put that into this framework, because I think the framework is nice.
Yeah.
I think so. And yeah, we kind of have, categories, and I mean, isn't a lot of that simply a replacement of more complex language?
Some of it is moving. So under possession, where's the one that says the 1 ounce limit? We're going to move it. It was somewhere else, and I think she may have got that, because now it's under possession, and that's fine. And then make the federal law note, that's that little remember thing, somewhere in there you're going to have that box, what kind of?
Call-out box.
Call-out box that reminds people that this only applies within Vermont, that it applies to both visitors, temporary and permanent residents. Seriously. People are coming here to ski.
I thought I could speed in New York because I'm not a resident. Is that? Oh.
But if we discussed the case of if I come here to ski from a state where I can legally use marijuana, and now I'm in a state where I can legally use marijuana, why would I not assume I can legally use marijuana in my hotel room? But you can't.
Right.
And that's where I think people can get confused, and why the language has to be just like blunt.
Thank you.
And I think she did say in here that I think she did get in the medical. No, we're replacing this, the same conditions on driving apply to medical marijuana card holders and all others alike, with having a medical marijuana card does not exclude you, driving is still prohibited.
So, and he was okay with that?
Yes.
That's great. Okay, good.
So where can I use? Where's the where can I use? Well, you've got it under, marijuana use should be really where can I use, not marijuana use. And that's where at the end we're going to include that statement. If you can't smoke tobacco there, you can't use marijuana either. So it's not a whole lot of changes.
Yeah, I mean.
And I think it could easily fit in.
I mean, you're changing wording, you're changing a couple
Placements, a couple placements.
but pretty much the ideas can
Is about the
continue.
same, yes.
That's great. You know, I mean, that's what we wanted to get from Nick, and so I can foresee it simply being a cut and paste.
I think so.
And some call-out boxes.
Call out boxes, I gotta write
Call-out
that down.
boxes.
You think that she'll know that?
I think she'll know what that means, and if not, I'll look like a fool. But
No.
so are we? I guess I have two questions. Content,
other
I'm leaving up to you guys. I think it looks fine. Are we worried about a law passing legislature in the next couple months? And how does that affect how we want to proceed? And then two, Julie's quote for what was it, 1,000?
For $1,930.
Yeah, it was lower than what we budgeted for, so I don't know if we want to. I don't know if that's sufficient and we want to roll with it for 1,500.
My suggestion on that was going to be that we consider that. I think, unless I missed something from Julie, that was one place. So, just in the interest of making sure we're getting
Diligent.
a good deal and diligent with our funds, that I was going to suggest that we pick. The motion would be to approve spending up to that amount, but that between Julie and Steve and I, we would do the due diligence to make sure we had other bids without telling people what the specific bids are, to say
Can you do
will,
better than this?
This is the best price.
This is what we were looking to do, get the bid, and give Julie that authority by this motion, that we'd be able to spend up to that amount, but it would be obviously based on the consideration of what the product would look like, and we could evaluate that with her to determine that if someone could do it at half price, but it's going to be black and white and not something we could fold, we'd have to have a scoring capacity to do that. So just generally, it would be a motion, if that's what you're ready for, that would be up to that amount once the other bids are considered.
And you mean up to the 1180? Up to?
Or up to the 2,500 we originally budgeted for.
Oh, okay.
Right.
Or no more than. But I suspect it'll be
Less.
Okay. It'll be, if it's less, that's great.
I expect considerably less.
If they go over, we can print more.
Yeah. Are we thinking?
People like-
Are we thinking 1,500 cards is more than sufficient in terms of what we should do in a first printing?
I think so, until we.
We always print more.
Yeah, I would not go wild on printing. I mean,
We'll have sufficient time to evaluate it,
Right.
and then there'll be another fiscal year in a few months to say if
that's true
this
too.
was really, it went wild, and a lot of places were interested, and between government offices and other places that would like them, that would be the appropriate time to then seek other people to help with us. We can add their logo on the back with us if they helped, and the next time we could print a lot more if it's that popular. But yeah, this would be a good test run.
And also, if new legislation does come out in this session, it's probably, like the past legislation, going to be an effective date down the road. It's not like going to be right at the end of the session. And then if we reprint, we could make any changes if we did need to make changes.
Okay.
yeah, fair enough. So we're moving forward on the changes to the text, and that looks like that's stabilized now, and we have text that we all agree on and has been vetted by the city attorney, so we're good there. At this point, it's finding a printer that can do the job that we want to do for our best price, and going from there.
What
Fair
does
enough.
that say there?
Yeah.
Does that say anything? I need to
Yeah.
read
It says. With marijuana use legal in the state of Vermont, the City of Burlington Board of Health wants you to use marijuana safely and legally. This card gives you a quick review of safe and legal
You
use in
can
Vermont.
read that?
I can
young
still.
eyes.
I have contacts on.
Okay. So
That's red
what I'll
against
do,
green.
how about
It's
if
the
when I-
color, that contrast is just not.
How about I take
Yeah,
this
it's hard.
and write it onto here and make the corrections on here and then upload that to Julie?
That
to,
would be
to give to the
fine.
graphic designer,
Correct.
is that
Yeah,
okay?
yeah.
Okay.
If you could just CC all of us.
No, I can't. I can CC Steve. I can't CC all of you. That was what the attorney asked us to do. And he can CC you.
Oh, very interesting.
He's being uber careful
He is,
of
I think.
open meeting law, apparently.
All right. Very well. Well,
And that's why we sent it this way. He requested that.
Okay.
Were you looking for a formal motion on any of this, or do we want to?
We will need a formal motion on funding. And I think what Bill says is perfectly appropriate. So if someone would like to make a motion about spending up to.
Do we want to just say $1,500 just to be safe?
I would go in that direction.
Okay, so I would motion that we allocate up to $1,500 to pay for printing
Of up
this
to
card.
1,500.
Up to 1,500 cards at $1,500. Sufficient?
And I would say, and so just, I think it's implied, but, and you're giving, once we made that decision, you're giving Julie authority.
I'm giving Julie authority to make a decision on printing
Okay.
with staff.
Does that, you got that, Steve? Okay, then I
You'll
second
make that work.
part. I second that.
3 years with Public Works.
Yeah, you know.
Something
Yeah, you make that work.
Okay.
So we'll have a vote. All those in favor of say aye on that motion.
Aye.
Aye. Motion is carried.
And then
Again.
I will make a motion that, maybe you should make a motion that I can,
Do we want to
Make-
make a motion for that? Or just say Caroline can do that.
I don't really have to make a motion that I can do what we just agreed to with the language and send it to
I would
Julie?
say that a motion is not necessary because this is
I
all.
say do it.
We're,
All right.
we're continuing
Yeah.
the editing
Yeah.
process,
Okay.
and this seems to be the end of the road, fortunately, or
I know.
in terms of the edit process. But
Okay.
yeah, thank you for asking. Though.
All right.
All right. So we've gone through approval of the card text. Thank you, Carolyn. Update on graphics. Thank you. Production and distribution timeline. I'm just going to point, before we move on, I'll just point out that come to next meeting with brainstorms on how we want to distribute this and where we would like it to go and so forth. Because, 1,500 cards may or may not be a lot of cards to distribute in our community. And on the one hand, they could go quickly, but on the other hand, we don't want 40 cards a pop going into the trash when someone says, it's just, no one's reading these, no one's taking names because they've been buried, and they just, throw them all away. Alrighty. So on to item number 5, the chair's report. I will simply report there was a Champlain school inspection on Tuesday. Marty Spalding and I went through right as the snowstorm started, and I haven't written up the report. We did go room to room as we have in the past. Just prima facie, I would simply say that it seemed that while the maintenance and orderliness of the school and the facility and so forth, it was very similar to what we have grown to expect in the past. I had the impression that perhaps there were some extra clutter in some of the rooms that was more teacher related. And I think that will probably be the main comment that will come forth in the report. And I'll write the report as soon as I am able and get it out to y'all and send it to the principal of Champlain School. And
Yeah, I'm
we'll go from
sorry I
there.
wasn't able to change dates.
Oh, I know. Yeah. So, and that said, I mean, thanks for tickling my brain. next time around, I will include potentially the principal, I don't know, but certainly Marty Spalding in the Survey Monkey poll, so that, yeah, we are a lot of cats to herd, and it's a challenge to find a time when everyone is available to do these. So, yeah. But that's how we'll roll next time, with the hope of being able to do this more efficiently. So.
Are we thinking another school, after school's out, likely? June,
It would
July?
be wonderful maybe to do one during spring
Yeah, spring
vacation
break.
or something.
Which starts tomorrow.
Well, that's,
April.
but there's an
Spring
April break.
Oh, that's
vacation.
right, they get 2 weeks.
Yeah, that's spring too. Yeah.
Wishful thinking.
It's winter break.
Yes. I'll need to write the report first.
Yeah, you take your time. Do what you need to
Until
do.
spring.
Yeah.
But, hey. So that's that. And so, yeah, any questions, thoughts?
Since you brought up the thinking for next month's agenda, the distribution of the marijuana cards, I would also like us then, since we maybe will be done with this particular project, to get back to and finalize the idea of a pre-approval process for like the pesticide
Pesticides.
application things, and so that we could finalize some type of rules and
Administrative
form that
approval, yeah.
you guys could use, and then we wouldn't have to come every time. Other than maybe a summary report, as you suggested. So we could kind of put that issue to bed. And I didn't want to bring this up, an emerging issue, since we already had an emerging issue that had a lot of talk, but I was at a composting is going to come up, required composting, and that is definitely a health issue. So I think it's something we might start talking about. What is the city going to be able to do? There are some companies that are starting to come forward that will
You pick up.
do pickups like that, and one of them advertised at the senior, what do you call that, where you go to the Hilton and they have whatever that is. 2 young guys who started this because they know that not everybody is going to want to do their own composting. And I really haven't looked at what are going to be the rules and whether the city has a plan for pickup or what. So I think that's something as a health issue we might start looking at, since isn't it coming next year? This year? Next year?
It definitely was originally 2020. I don't know if that got moved or not.
What I can do is I'll check with Rob Green. He's the Assistant Director of Public Works. He is responsible for the recycling. He would be our point person for the city in that. And probably not good timing to do it the next month, because it's one, it's short notice, and since it's a long way away, just plan for it in the next few months while we're at DPW, maybe to have him come to one of those meetings when it's convenient. I will say, kind of on a related topic, that code enforcement has been doing some surveying of a few target streets of our existing recycling issues, of which there are many. I think, as a resident of Burlington, I'm sure you've seen them, and I don't know any neighborhood that doesn't have some level of what I think is disorder, because you have the bins that are not covered, and even residences. We see it a lot in rental properties, but the rental properties, I think in a lot of cases, it's people who are trying to do the right thing. They're actually trying to recycle a lot of things, and as a result, you have snowy, windy days, and things get blown out or tipped over. So I say that now because that might tell us something about what might happen with compost if we have a system that right now hasn't been fine-tuned to be able to capture that. And our results are still preliminary, but we'll be adding a March and April period where we'll be doing an additional education campaign in March with the findings that we have up to now on these 7 streets, and then an enforcement campaign in April, which would include ticketing of either specific properties that are the worst, or we'll set a a point to say, what that threshold is, but I expect that through the education campaign, we'll be able to show a specific percentage of people were, a greater compliance level, and then the enforcement, I would expect people do pay attention, even if it's $100 or a $200 ticket. That's enough for people to say, I had no idea that you could get a ticket for this, but we need to have something to demonstrate the worst places should have some punitive action if they don't follow the education campaign. I expect there'll be pretty clear results from that, so I'll be happy to share that with you come May, when we should have some more permanent findings. But I think it'll help inform the compost issue, because I think people will be doing the same thing. They're well-intentioned, but if it's not well managed and well run, it'll be a really
mess.
A real challenge and a health threat.
And there are probably a percentage of people who will decide they're going to compost themselves. We compost, but there's a lot of people who are going to say, I don't want to do that, just give me another box.
It would be hard to do it when you're in an apartment too. I mean, you're going to have to pick up. Well, We've used, my wife and I, I'm not sure if it was that company, but last winter we used a company and found it very useful to do once every 2 week pickup.
But I don't think people are, we want people to start thinking ahead, so that's
in a covered.
In the covered container,
Yeah, that's the important part.
Yeah.
Oh, they give you these.
Yeah, they give you, and they swap out the bucket, and it's kind of nice.
I do know a thing I learned from Family Room, that you don't put bread in composting. It attracts vermin, number one. And I said, don't they like orange peels and eggshells? Or no eggshells too. No, that's a disposer, sorry. But there's certain things that, this is a compost that's taken up to the group housing on East Avenue, right at the, what is it, co-op? And so I asked that question today, because I said, is it a different timing of the breakdown and all of that? And she said, no, it draws vermin specifically, and without it, they're fine. So, all we need to see is one, I'm not afraid of mice or rats, but somebody who lifts up the lid and one jumps out and...
And the law says everyone's got to compost everything as of 2020.
And what they're going to do with meat bones, I don't know, because you can't compost them.
And that's why I'm thinking that CSWD is the entity that's going to pick them up, because they have the biggest operation, or do curbside pickup potentially.
As I dimly recall, I mean, I was working with CSWD a few years back, and I think some of the haulers would be getting into it. The Gothiers and
Myers and whomever else.
Casellas and so forth. So.
All right. Well, I just wanted to.
No, that's a good issue that we should
start looking at.
Yeah.
Okay.
So scheduling. If we're interested in having a discussion on permitting for pesticide permitting, streamlining that process, I think that closely relates to the emerald ash borer issue and the pelletizing or in trees and so forth. And one thing that we never were able to do was get the city arborist to come and speak to us. So it was an information gathering issue. And Bill, would you be in a position to invite the arborist to our March meeting?
Sure.
And then, would it be appropriate to invite the gentleman from the recycling who in April, or?
Well, let me just mention this. I was going to tell you at the end when we talk about the next meeting, but I'm combining a few days of vacation along with a week of training that I'm going to. It'll actually be from March 6th through the 16th, when I'll be away, which I think will be the next meeting. So no problem being here, not being there if we're going to have the city arborist come. But I think some of the more substantive conversations, since it'll involve enforcement, and Steve wasn't
Yeah.
here
Mhm.
for previous actions, I think I would definitely want to be a part of the, anything more substantive.
Well, I would not have a problem moving from that week, because I'm having eye surgery that week, so,
And I'll be out of town till the 16th.
well, that's a
So,
Saturday.
so two of you will be out of town until the 16th, you're saying? Is that right? You said you're...
I'm not a board member, so I don't,
Sorry. Well, I said
you can
two
still
of
have
you,
a
I didn't say-
quorum, but, and
Yeah.
and if
But we
it's
have-
not convenient for
yeah.
you,
I mean, we
Caroline.
can move the meeting, the March meeting.
I mean, I can come on on March 14th. I may not look great, but I can come.
You wouldn't be able to see it.
I can really. I can move it back a week. I can do the 21st.
I could do the 21st.
I think I can do the 21st.
I think I could do the 21st.
Okay. Well, I gotta pencil that in now. I'll keep both
Oh, the
penciled
16th
in.
is a Saturday, I didn't know that.
Mm-hmm.
We're going from the 1st to the 16th.
Okay.
So,
And on our March 21 meeting, we'll work to get the city arborist, and hopefully
Okay.
that person's schedule will be free for that
We'll give them a
evening.
little more time.
Just as a point of order, could pencil it in, I would say, but we should confirm the space is available, and if not, Steve and I can work on an alternate space.
Good
Since
point.
we're moving, that would be at the 645 Pine Street location.
Mhm.
And if for some reason there's another meeting that night, we'll look at alternate locations and maybe put it out. The decision on a location could still be done by an email, but
Yeah.
we should at least confirm that before we lock it
Good
in
point.
as
Good point.
official.
Yeah,
Okay.
okay.
And I will, once we have that locked in, then I'll definitely do the invite to the city arborist.
Sounds fine. And to circle around, back around discussion of the FY19 budget. Thanks, Taylor, for putting this together.
No problem.
Um,
Well, since we made a decision tonight on the marijuana informational card printing, we've got more money.
So, completely out of the blue, but since it just totally came into my consciousness today, I was listening to a webinar put on by the National Library of Medicine, I guess. Yes, Library of Medicine, and they have traveling road shows, and it sounds as though they oftentimes partner with public libraries for quite a reasonable cost to put up displays that are essentially educating people on I guess it's the National Library of Medicine website, but it's a way of educating the public on health issues, and particularly like medical issues. And it's a resource that the public website can go to. I'm thinking Medscape and
It's
and
encouraging
WebMD
people
and so
not to
forth.
just use Google,
Right.
but to use medical sources.
Exactly.
to get their
Exactly.
medical
And
information.
I don't know a whole lot about it, but I wanted to kind of follow up. But if they were saying $200 worth of shipment of the display, and it sounds as though there are a number of different kinds of subject matter displays that can be sent around and so forth. It apparently is sort of self-explanatory, self-standing, and so forth. So you don't need to have experts staffing it, or it doesn't sound like it's a big installation that's going to require the complete renovation of 4 rooms or something, like in an art gallery or whatever. And if interested, I would think it might be kind of an interesting partnership to do that with the public library.
Fletcher?
Yeah. And if you have any interest, I can look into this and ask some questions and get back to you.
I think that's not a bad idea.
No.
And they had a display, I forget who, put it up, but I don't know if any of you went to it on the evolution at the Fletcher
Oh, at
Library,
Edmund?
where, and that was a traveling display. I don't know whether it was the Smithsonian or National Geographic Society, and the library hosted that, and you know, a lot of people came through to see it. So I think people would come, just users of the library, but a lot of people go to those community medical school lectures. I don't know if any of you
Yes.
have
I
gone to
gotta do
them,
that.
and so
I gotta do
I think people would come if they knew it was at the library, especially depending on the topics, and you'd have to find out, well, what are they offering
Mhm,
to
mhm,
send? But I
mhm.
think that's a reasonable
Yeah.
thing for us to
Yeah.
do.
Okay. Yeah, I mean, I like the price,
Yeah,
frankly.
price
it's
is
like,
good too.
What
oh,
was
Is
the
it like
price?
200 per topic, or
Is it?
I think it's like 200 per box,
Oh,
and
whatever's in the
and-
box?
yeah, but it sounded like there were
Denver.
only a few boxes that would need to be shipped. So you know, a few
Okay.
$100 or something like that. And I was thinking, gosh, that's Board of Health money, you know, or
Yeah.
budget.
Within
you know?
our budget.
Yeah, right. Okay.
But I think that's
I'll-
worth looking into. Yes.
Okay.
Yeah.
And yeah, so I just jumped in, but if there are, you know, this is way off of anything we've ever discussed in the past, but you know, theoretically, we need to be focusing on substance abuse, which is one of our strategic plan topics, housing, which is one of our strategic plan topics, and environmental health, and
Well, on those topics, both housing and substance abuse are something that Spectrum deals a lot with. They certainly need funds. I'm not sure exactly what particular programs might, but I know we've given to Safe Harbor and other things, but I think that's an organization we might consider partnering with.
yeah.
I'm not sure how
I would be
to-
really, I'd be really interested, you know, in the past we have simply granted money to organizations. I would be really interested in partnering with organizations and doing work with them, and if it involves, you know, providing funding assistance to do so, I think that would be great. But I would like to do something more than simply sending a check.
Right.
Well, I'm sure if you talk to Mark, he would come in.
Can you?
Talk to
Sure.
you?
Yes, of course.
Oh, yeah.
Great.
He'd come and
Yes.
talk to us.
Thank
He
you.
would come and talk to us, and you would all be convinced that we should give it all there.
Oh, I'm always, I give every month, so.
So do we.
It's
but-
just something that
But he
is very.
He will explain
Mhm.
what their greatest needs are. I mean, they do a lot of fundraising that bring out a lot of big names and everything, and that's fine. Whatever it takes.
Mhm.
But, you know, the nuts and bolts of the place. I mean, he's so proud of it. It's amazing. He
Well-
gave me a tour.
If he has some ideas and could come, I don't see, because we're working on the budget now, I don't see why both the arborist and Mark Redmond couldn't
You'd have to
speak
give
to
him
us.
time. But I can
It
do
might-
whatever you want in that regard. 'Cause I
Would you
can
be
do-
able to reach out to him and see if he can attend our March meeting, whenever that date ends up being, in this location? That'd be great.
I
Yeah,
communicate with him, you know, regularly.
super. That'd be great.
Thank you.
And I missed going with Julie to meet somebody. Is that how the ball got rolling
For what?
for the marijuana raid? Didn't somebody come into town?
Yes.
She was in town and Julie met with her,
Julie met
right?
with her.
Yeah.
Yeah, and I miscommunicated to myself. Gee, that happens way too much. But she was there and I was at an appointment and I couldn't break away. But I told her I would go with her anytime and because I can. And I missed it, but I will contact Mark Wagner and talk about mid to later March, right?
21st.
We're talking,
21st.
Right now,
tentatively it's the
Tentatively.
21st.
So that would be the earliest?
I think so.
Yeah, because one before was
This is the one before.
we're
For
This
the,
is February, yeah, and March 21st is the next one.
but it wasn't originally 21st.
It was the
Correct.
14th.
It was the
Right.
14th. It's not going to be the 14th. It may be the 21st.
Anytime after the 16th is okay with me.
So we're just money wise then. I mean, we said we were going to hold $500 in reserve for more printing if we wanted. But I put in $1,500 for printing the card. So if we were going to partner with the National Library of Medicine, Spectrum, I've also got the family room in the school district alcohol and drug program. It looks like we got about $1,750 to work with no money allocated towards those last 4 programs, and with $500 left in reserve. So,
Okay.
I think I don't know if we have to make any decisions, but that's kind of where we are. Just we've got money to spend.
Yeah.
Well, I think there's a couple good ideas
Yeah.
here, and we need to hear a little more about them. And
Yeah.
we should by next month. That won't be too late to allocate.
No. You guys just got to know, hopefully by April-ish.
I don't want to go past April
Okay.
if we can help it.
Yeah.
Yeah, but even if it's just that one that we wait after
Yeah.
with 500, that's easier
Mhm.
than trying to do
Yeah.
6
Whole
purchase
amount.
orders in the
Yeah.
last month of the fiscal year
Is
is
there
challenging.
Any way, when I talk to him, or even if you wanted, David, if he says he'll do it, to let him know a range of what money we have to do this, and then.
Well, I think we do have to let them know we're not like $10,000 donors.
Yeah.
Exactly.
And but there are programs that we do contribute to several years in a row, so it's not like this might be the only one.
Mm-hmm.
But
But
should we?
We're looking
Something
to provide money to Spectrum, related to some issue linked to public health, maybe in the realm
homelessness
of
is a big one, housing and
Substance abuse.
substance
Those are
abuse.
two things.
So in the realm of maybe to $400 to $800, depending on kind of where we are.
Yeah, I think that's fair. And
It could be a little more, it could be
No,
something
yeah.
that would come again next year.
Yeah.
We just don't.
He'll understand that.
Yeah.
I think, what immediately comes to mind, I guess probably because we've just been talking about it, but like printing costs of materials that they may either already produce or may want to produce, and maybe if they want to produce it, maybe we can assist them in writing such materials or something, or developing such materials, or finding such materials.
They might want our marijuana cards.
They might
They
want
might
our
Oh,
marijuana
they should go
cards.
right on their table.
Seriously.
But not just, someone should be doling them out, so that they're not just take one and somebody grabs a handful. We don't have the money to just have an endless supply. They
Well,
should
we
go.
can talk a little bit more about that
Yeah, yeah.
next time.
But I'm sure, they do, they've got good people working there too.
But again, partnerships, not simply grants.
Yeah.
Yeah,
And
that's
so
really
I
good.
think the ask would be, come and, what's way down on your on your to-do list that you haven't been able to get to but really want to, and how can we help you with that?
Yeah, that's a good
Mm-hmm.
Then an article somewhere about that partnership.
Yeah.
Put that in North Avenue News.
Exactly. That makes sense.
Yes.
Can I throw in another
Yeah,
one?
sure.
Just on the creative side for next month, Mark may suggest it, but the car detailing business that former.
yes.
Oh, I used it.
Thinking
You
of something
you?
like, so that's something that they do gift certificates for people to be able to get their car detailing, and it benefits, the youth in the community who have, worked with the Spectrum services. Mark's a big supporter, and that might be an interesting way over and above what he would be talking about for Spectrum, for you as a board to put, and it's not just that, but other things like that, where you
Yes.
could recognize some other people in the community as a public health hero, and we just wanted to say thank you, and it'd be a great way to give them some praise, and give the card, which would then benefit another organization. It's kind of an interesting way to do double good deeds, and also again thank people who might otherwise in the community not get that recognition. That hey, we noticed what you did, where you helped with the opioid issue. Maybe there are people who are doing work and not being recognized. The mayor just had a press conference today, and you were here, probably didn't get to see the news, but the 2018 numbers in Chittenden County specifically were the thing that was totaled for was advertised today. The overdose numbers for Chittenden County are down 50% in 2018. Comparatively, they're actually up in the rest of the state. So it seems like, you know, they're onto something. There's a very comprehensive plan that's happening, and Burlington's a big part of it, but I think there's something special happening, and that's the type of thing to watch for. And again, not that specific program should be the award mechanism, but something like that to sort of piggyback on something else that's good, and the board gives that something like that to another member of the community who you're a Burlington resident, and we just wanted to say thank you. You're doing great work.
Yeah.
So just throw that out for consideration next month, and I can do a little prep with Mark as well, or see if there's other things like that.
I
Thank you.
used the car
Okay.
detailing after I saw it advertised, because it is a Spectrum program, and those young people were very professional. It was incredible, the job. that
Where
they
where
did.
is it? Where is it?
You go out toward Industrial Avenue. I forget the name
Out
of
in
it.
Williston?
Yeah, towards
Mhm.
Williston, and you know, there's Avenue A, Avenue B.
Yeah, yeah,
all- it's,
yeah, yeah.
I think it's one
Back in
of the,
there.
I forget
Yeah.
which one of those
Okay.
avenues it's on, but
Interesting.
It's about $150 or something,
yeah, for
and
I hate doing it.
It's hard work. It's hard work.
I really despise detailing my own car. So, okay. Just good to
I
know.
always
Yeah,
called it
okay.
cleaning out the car, but I guess detailing is where it comes
So I mean, I'm sure there are small things like that we could
Yeah.
partner with if we could kind of figure it out.
Mm.
I like that, thank you. Do you want me to
Alrighty.
have him call you, Bill, or?
I can reach out to him separate on that issue if you're going to ask him to come to the
Come.
meeting.
Oh, okay.
Yeah, your
All right.
ask will be to invite him to our next meeting and to bring ideas about how we can partner and ideas of things that he might wish to have some assistance in funding with, up to $800 or thereabouts.
Wow.
So that, Taylor, do you have any other comments on, I mean, you did a nice recapitulation there of you know, where a revised budget.
Yeah.
Anything else?
No.
Okay.
No.
All
You
right.
guys tell me how you want to spend your money, and we'll just keep tabs and make sure we spend it by April.
Thank you. That's great.
It's fun to spend other people's money.
It's our money.
I mean,
It's our money.
I know,
How
but
good is
it
the Board of
doesn't
Health?
come out of your bank account.
That's true.
Okay. Public
It's there.
outreach and communications.
The money's there.
I'm actually feeling a little uninspired in terms of, I mean, we've done a lot of great stuff tonight, but
I feel like our
It's-
outreach is
it's-
coming when we print these cards.
yeah.
I'm not
the-
sure we can
Yeah.
make a statement about things that were discussed tonight since they're
Right, because
not
they're like
finalized
half
and
completed
they're
at
half
this
in,
point.
yeah.
So yeah. I'd be interested in. I mean, the Governor's Opioid Council came out with their second annual report last week, and I would be interested in giving a shout out about that in a Front Porch Forum post. Would anybody have the time to?
Read? I don't know what it is.
Sorry, the governor's report on what?
The Opioid Council.
Gotcha.
Okay. And yeah, there's a lot about looking at looking at what has been accomplished versus looking at
Mhm.
you
Morbid
know,
statistics.
the morbid statistics, which granted continue to be concerning,
Mhm.
but at the same time there has been a lot of progress made, and I think that they do a good job of calling that out. And what was I going to say? Oh, and there's a lot of discussion about this so-called Iceland model of prevention, which is, essentially building connections where there weren't, and providing funding and opportunity for clubs and activities and this, that, and the other thing, so that people can find something else to do other than hanging out and getting in trouble, right? So I do have the press release, at least from the Department of Health, that came, that I can forward, and it also has the link to the report. I'm looking for volunteers because I know that I have so little time right now, but
I just haven't even read it, so I
Do
don't
you,
know.
do
I haven't read it either, but I kind of.
this press release?
3 sentences, 4 sentences,
Do you want to
and
print that?
what's that?
Do you want to print that?
I'll do it, and yeah, and I'll have a link to the annual report as well.
I think we'll have more to say next month.
Oh yeah, but we should be getting. I mean, we're paying for this service.
No,
We-
I just
we
don't
might
know
as
what
well-
we
There's
should say
This is
at the
public
moment.
health that we can say endless things. So.
I'm not commenting on that.
Yeah. The next meeting is tentatively scheduled for March 31st.
21st.
I'm sorry, 21st, sorry. Pending identification of a meeting location. We tentatively hope to have the city arborist. And I didn't get his name. What is his name from
Mark
Spectrum?
Redmond?
Mark Redmond, sorry.
Oh, the arborist is, I don't know, but.
VJ.
It's,
Yeah.
he's Indian, Indian name, from India. VJ.
At the March 21st meeting. And so you'll get back to us in terms of meeting place and whether it works or not and everything like that. Great, super.
We should be able to let you know tomorrow, just
Yeah.
to
Look at the
lock
calendar,
in.
yeah.
Right, it's just, once we block it, we'll have that locked in, but it's hard to say since it's an
Sure.
odd night for us,
Oh, yeah.
what we might be competing against down there,
Who
so.
knows? Right, exactly.
Okay.
All right, so
Can I just
are there any
make
other?
A light note,
Sure.
I went to the farm show, which is most interesting is health consideration. I remember talking to a guy who was using Roundup, in his farm.
Oh,
But I did bring this, and it doesn't have much more to say than, I talked to him about injection for this,
Mm-hmm.
and the guy said, "Oh, that's useless."
he said, well,
It was useless, you couldn't keep up. Once they get here, you're toast, you gotta get rid of them. But trees,
right, well, I think that's
well.
not
you know,
necessarily
nipping-
true.
No, nip it in the bud, but anyway. We'll see. Anybody interested in looking at that? We don't want to see it exposed.
I think I'm up on it.
Do you have any, yeah, emerald, do you have emerald ash?
No, I don't have it, no.
There are certain clumps around Burlington, I think up by the, Christie area, there might be some there still, but.
The arborist will be able to tell
Yeah,
us.
the arborist
Got a
will tell us.
complete
Yeah.
study or survey of this, of the city
Yeah,
trees.
yeah, but anyway, just saying.
All right, thank you. Someone want to call it?
I make a motion to adjourn.
So, second.
Second, and all those in favor say aye.
Aye.
Thank you.
Have a
Good
nice
evening.
Valentine's